have weak erection and wondering the cause of your weak erection or erectile dysfunction? In this video, I'll be discussing the top 10 causes of erectile dysfunction. So before I go on to discuss the causes, let me quickly explain to us how we get erections. So erection happens when blood flow to the penis is sufficient enough to cause the tissues in the penis to become erect. So in simple form, when there is enough blood flow to the penis, we get erected. However, if the blood flow is not sufficient, it will not be hard enough. Okay, so what are the top 10 causes of erectile dysfunction or weak erection? Number one is psychological issue. Psychological issue is the cause of your erection if, for example, when you meet a particular person, you find it so hard to become erected. However, when you meet another woman, you are fully erected. Or secondly, for example, when you watch pornography, for example, you get erected. However, when you meet a particular woman, you don't get enough erection. That's a psychological problem, not a medical or an organic cause. Okay. Number two cause is performance anxiety. Most times we get weak erection because we are too anxious, too eager to perform, too eager to please, to satisfy, to impress someone, to impress a woman. When this happens, your brain struggles with all these emotions and you find that you begin to have weak erection, but it's only temporary. Number three is prostate problems. If you are above 60 years old and you are having weak erection along with problem with urination, my dear, you are highly likely having a prostate problem. For example, you tend to strain before you pee, before you urinate, or you tend to have difficulty, maybe increased frequency of urination along with weak erection. That can be a prostate problem. Number four is what we call hypogonadism. In simple form, low levels of male hormones. Again, it happens in older people. As we grow older, our body becomes weak. Our hormones, which makes us masculine, which makes us male, also reduces. And when this happens, we begin to have weak erection. It happens in old people, especially who, for example, previously used to have bulky muscles, maybe a bulky chest, and now they have weaker muscles and maybe a flat chest, for example. Those are signs of old age, hypogonadism. Number five is high blood pressure. High blood pressure causes narrowing of the blood vessels, which are supposed to carry blood to the penis. And when this happens, when the blood vessels narrow, remember that the blood flow to the penis will become reduced, and this will make you have erectile dysfunction or weak erection. Number six is diabetes. If you have diabetes, unfortunately, it causes damage to the walls of the blood vessels. And when this happens again, it will reduce the blood flow to the penis, making you have a weak erection. The next one is what we call atherosclerosis. In simple form, build up of cholesterol in the walls of the blood vessels. And when this happens, again, it reduces the lumen, it reduces the blood flow to the penis. And when this happens, when the blood flow reduces, you will have a weak erection. The next point is smoking and alcohol. For those who smoke and drink alcohol, unfortunately, in the long run, you'll begin to have problems with your erection. So try to cut down on this smoking and alcohol. The next one I want to talk about is stress. My dear, if you are too much stressed, the body will begin to sense this stress and will release a hormone we call steroid. Steroid is a stress hormone. This steroid will cause a problem with your erection. So what can you do? What can you do to help yourself to prevent this weak erection or erectile dysfunction? How can you treat this condition? It's simple. If you're able to identify the cause of your erectile dysfunction, you will be able to treat it. For example, if you have high blood pressure, try to control your blood pressure. If you have diabetes, control your diabetes. If your cholesterol is high as well, get it under control. And if your problem is anxiety or maybe too much stress, try to relax more, try to rest more, because the more you rest, the more you relax, the better for you. And for those who are obese or who are overweight, try to lose weight. Exercise more frequently. If you do all these things, you will see your erection begin to improve gradually.